business news from the Capital Region. This is Washington Business Report with ABC 7 national correspondent Rebecca Cooper.
We'll have those topics and more in our roundtable, but first we're going to check up on one of the biggest employers and biggest industries in the Washington region. MedStar Health is the district's second largest non-federal employer, and it's the largest not-for-profit healthcare delivery system in the region. MedStar's annual revenue is now $4.4 billion, but there are challenges facing the healthcare industry, providers, and major hospitals. Joining us today, Kenneth Samet, President and CEO of MedStar Health, the man in charge of managing 10 hospitals, tens of thousands of physicians, and serving 500,000 patients per year. Ken Samet, welcome to Washington Business Report.
Thanks, Rebecca. Nice to be here.
Well, I love reading your background. You went to Old Dominion to study medicine, but it was running the concession stand and organizing all your fraternity brothers that made you realize that you really had a feel for business, so you pivoted and now are on the business side of healthcare. What are the biggest challenges you think you're facing right now?
Well, continuing to provide the highest quality and safety to residents across the region, and to do that in a set of very changing healthcare policy times, with more and more changes to economics, challenges to economics, but still very much focused on what do we do at the point of care for every individual that comes to us for care.
Now, you were with the original company that later evolved into MedStar from the beginning. You say you've kind of done the old-fashioned route of staying with one company over time, but really it's a company that's changed dramatically in the decades that you've been there. What are some of the biggest changes you've seen?
So I came to do an administrative residency at MedStar Washington Hospital Center 30 years ago. You wake up and it's hard to believe all those years go by. And for me, and it speaks to MedStar Health, the company changed so significantly. You mentioned 10 hospitals, 100 different care sites. The challenge for us is to connect all of that into what we call a distributed care delivery network. We have to take care out to where people live. Access matters, convenience matters, cost matters. But through the eyes of a patient, it doesn't feel like one connected delivery system. It just feels disjointed. So our challenge is to have one standard of quality, of safety, of service, to have information that's ubiquitous so you as a patient only have to register once across all our sites.
Now, you all are the leader in the field, so you know all the benefits that come with the quantity of size of delivery of health care that can come with being able to have all those resources at your disposal. But you've also heard your critics, patients who say that when they go to a MedStar hospital, they almost feel overwhelmed by the size. How do you manage quantity and quality?
Well, you need quantity because it's been proven that when you do more of a particular kind of care, heart care as an example, the outcomes are actually better. On the business side, size matters because we can purchase at cheaper prices. We can bring efficiencies and economies. So all of that matters. But having said that, right in our tagline, we put focused on you, because if we forget that every single patient just cares at that moment what their care is going to be like with their caregiver, then it all goes for nothing. That's the most important thing. So to your point, how do we balance a system and an infrastructure that lets us provide the best care, really providing value, but have that patient feel like we're focused on them?
Well, you have a business mind, but you didn't pick an easy industry by deciding to keep your focus on medicine. It's a challenging industry where you have to constantly stay ahead of your competition. You all have found some innovative new partnerships. Tell me about the Cleveland Clinic partnership.
Well, we're very excited about our relationship with the Cleveland Clinic. It actually started several years ago when we came together with the MedStar Institute for Innovation and the Cleveland Clinic Institute for Innovation. No matter our size, no matter how proud we are of what we do, we have to, as a leader, think through new approaches to healthcare. In the heart space, MedStar Washington Hospital Center has been the clear leader in heart care for many, many, many years. So you take the regional leader with the Cleveland Clinic Heart and Vascular Institute, the clear national leader in heart care per U.S. News for 17 or 18 years, we bring strength and strength together, focused on research, finding the best new approaches to cardiac care, focused on linking our doctors and their doctors to think about how cardiac care should be provided. And from a business standpoint, you may know the Cleveland Clinic has had some national contracting activities. So Lowe's, as an example, contracted to send all of their employees to the Cleveland Clinic. This will bring the Washington Hospital Center, the MedStar Heart Institute, into that national network.
I was interested in that, and as you know, Johns Hopkins has done it with Pepsi, but Cleveland Clinic has done it in a lot of different areas. That was not part of the original collaboration, but you think that will be part of the future?
Yes, it is absolutely part of what the Cleveland Clinic leadership, Dr. Toby Cosgrove and I, intend to happen. I think it creates a good opportunity for the Cleveland Clinic as well to have an East Coast site.
So in other words, your employer makes a contract so that if their employees go exclusively to MedStar, then you all can bypass the middleman and bring in more affordable pricing.
Right. For certain kinds of care, you'll see large employers actually contract directly with health providers, in this case through the Cleveland Clinic Heart Network.
Now, hospitals are under fire right now with the advent of the Affordable Health Care Act. Providers really being blamed almost for the rise in health care costs. Some of that blame unfair, and is some of it warranted?
I think both. I think that as a country, the U.S. healthcare system is very complex, but remember, so much of what ends up on the balance sheet of cost relative to healthcare is driven by societal issues. So what do we do to actually provide healthcare long before someone shows up in the emergency department? It's expensive by the time you come to the emergency department and we do an intervention. What do we do around wellness, around managing chronic care? What's our societal policy relative to the homeless? I'll give you one example in Washington. It was cold last night, and there are thousands of folks sleeping on the grates. A number of them will end up with a respiratory issue. They will end up in someone's emergency department in the next week. That's a cost that goes on the healthcare ledger. It's a societal fabric cost. We need a bigger, more thoughtful, comprehensive discussion around that. Having said that, the business of healthcare has grown up exactly incentivized as we intended. So GE, Siemens, Philips, we sell a lot of gear, we sell imaging, we sell product, and so those interventions really do happen, and that's what the American public wants. If you have something that's bothering you, you want to be treated today. You don't want to be told, like in Canada, there's a 3-week wait for you to have an MRI procedure. Again, that's not the most efficient and effective system of care to be set up.
So we've heard a lot about the downside for hospitals of Obamacare, which even the president is calling it now, which is cuts in payments to providers. But you allude to possible upside, more health insurance for more people coming into the hospitals.
I think the fact that we know as a country, and I'm proud of this, that we will take care of everyone means that everyone should have coverage, so we can be more thoughtful as to how we take care of them. I think that's a good thing. I think that some of the insurance reform that's in the Accountable Care Act is important, so that you have portability of insurance. You're not tied to your employer to keep your insurance, so that pre-existing conditions don't keep you from getting coverage, because we're still going to take care of those people. So that's a good thing. Is it the ultimate document? Is it the ultimate piece of legislation? We all know it's not. It'll continue to have to evolve. We'll continue to work with it. But from a MedStar standpoint, we've actually structured our strategy that we call MedStar 2020 around the possibilities that the Accountable Care Act provides. We want to, as the leader, think through how to provide this distributed network of care.
So many questions. I could spend a whole hour with you, and we're going to have you back on again. But we were talking before the show started about some of the unique ways that with the size and growth of MedStar, you're able to partner up. Talk a little bit about, we were talking about your Georgetown University cancer treatment now being able to team up with Montgomery County. Give us some examples of that for people to know more about ways that MedStar is branching out.
So 12 years ago, we brought MedStar Georgetown University Hospital into our network, and we have a clinical and research partnership with Georgetown University that includes the Lombardi Comprehensive Cancer Center. And so as you think about cancer care, there are certain kinds of quaternary care that should be provided at Lombardi Cancer, at MedStar Washington Hospital Center Cancer Institute. But so much of the follow-up care, the chemotherapy, seeing specialists for routine follow-ups, can and should happen closer to the patient in the community. MedStar Montgomery Medical Center, one of our community hospitals in our Washington region, we now have an infusion center set up connected to the Lombardi Cancer Center. Specialists from Lombardi and the MedStar Cancer Institute rotate out to MedStar Montgomery, and so a patient can come in for important care and then see their doctors.
So you get your local
locally.
doctor, you get to see Marcus Welby, and you get the best of the best as well.
That's what we hope.
A plan for growth. Thanks so much, Ken Samet of MedStar. Thanks for joining us on
My
Washington
pleasure.
Business
Thank you.
Report.